Welcome back, everyone. One of the sectors hit by massive cuts has been the Department of Health. Some of those cuts hit health agencies that spearhead medical research and develop vaccines, as well as providing other critical needs. CBS News medical contributor Dr. Céline Gounder joins us now from Studio 57. She is the editor-at-large for public health at KFF. Dr. Gounder, great to see you. So we've seen a slew of firings since January, hitting everything. It's almost like an alphabet soup at HHS. It's impacted the NIH, the CDC, and the FDA, but help us understand how that changes how all of us live.
Errol, it's frankly overwhelming. The Trump administration is reshaping the American health system from top to bottom. And so we're seeing massive cuts to health infrastructure. 40% of the NIH and CDC budgets are being cut. And that is a total cut to HHS of about $40 billion. We're looking at some agencies within HHS disappearing completely.
And how is the Department of Health trying to bridge the gap for all of these losses? Because the perspective of the administration is they're making things more efficient and they're cutting waste.
Well, there is a new administration for a healthy America. So many of the divisions, branches that have been cut from the CDC are supposedly going to be moved to this new administration, but we haven't seen any kind of detailed plans about that. There really has been no transparency into what that's going to look like. And so it's very hard to hold the administration accountable for some of these promises.
Which is another note about how just early an assessment it is 100 days in. But the administration's been battling a number of health emergencies. We've reported on bird flu, also the measles outbreak. How has that either impacted the response or tempered the impact, considering we need to be prepared for future pandemics?
Well, we've seen the administration pull back over $11 billion in funding from CDC. That's funding that actually doesn't stay at the CDC. It goes down to state and local health departments. So that means that those state and local health departments that are trying to combat measles, for example, you also have Milwaukee that's trying to address lead poisoning in the public schools. They are not getting the funding. In the case of Milwaukee, they're not getting the technical assistance from the folks at CDC. They made a request for staff to help them, did not receive that help. So it's having very real impacts on the ground.
Yeah, a sobering update for sure. Dr. Gounder, always great to check in with you. Thanks for that.